In this lesson, we'll continue our discussion of the female reproductive system by taking a look at the uterus and the vagina. So let's take a look at the function of the uterus first. One of the first functions, it's going to be a pathway for sperm to reach the uterine tubes, the fallopian tubes. During sexual intercourse, the semen is going to be deposited in the posterior fornix of the vagina. So since it's in the vagina, it then has to go through the uterus to get up to the fallopian tubes, right? So it's a pathway. If conception does take place, the uterus is going to be the site of implantation. It's about a week after the conception, then there'll be implantation. And then the pregnancy will develop in the uterus. So we actually call from weeks 1 to 8 the pregnancy the embryo. And then the baby is going to be changed to a fetus. That's from weeks 9 right up until the time of delivery, right? So we use two different terms as far as the stages of the development. Embryo, weeks 1 to 8, the fetus, weeks 9 to delivery. So where is the uterus? Basically, it's between the urinary bladder and the rectum, right? So anteriorly will be the urinary bladder, and then posteriorly will be the rectum. The uterus actually tips over the urinary bladder slightly. It's kind of anterior and superior to the urinary bladder. We call that anteflexion. So this is an interesting picture. What we have here, we're looking down into the female pelvis, right? This is the front of the pelvis. This is the back of the pelvis. The urinary bladder is right over here. Then right behind it is the uterus. And then right behind it here is the rectum. Okay, so it's kind of an interesting picture showing the bladder in the front and the rectum in the back. Okay, so the uterus is a pear-shaped organ, and like I said, between the urinary bladder and the rectum, it's roughly the size of a pear that's upside down. It's going to be inverted. And I'll show you other pictures of that. Here's actually a good picture that kind of has a pear shape to it. Right, you can see this would be the bottom, this would be the top part here. We'll get more into this anatomy. Okay, here's a good picture showing how the uterus is tipped over the bladder. Here's the sagittal section. Here's the urinary bladder. And then you can see here's the uterus kind of on top of it and tipped over it. And this you can actually explains too when a female is pregnant how it pushes down on the urinary bladder. And this is one of the reasons pregnant females have to urinate so frequently because there's so much pressure on top of the bladder. So same as we did for the ovary, let's take a look at some of the ligaments that hold the uterus in place. We had looked at this one already, the broad ligament. This is that big ligament that extends, we'll go back to this picture for a moment, from the side of the uterus. So here's the side of the uterus. Here's the broad ligament running right over to the abdominal wall. Right, here it is on the other side. So we looked at that one already. A new one is the uterosacral ligaments. So you can kind of guess this attaches the uterus to the sacrum posteriorly, and that helps to keep the uterus from moving forward and even down, like dropping down into the pelvis. That would be these ligaments here. So this ligament here and this ligament here, they're going back to the sacrum. They don't show the sacrum, but that's where they would be attaching. The next ligament are the round ligaments. These are two ligaments that come from the front of the uterus and they extend forward and they actually go in through the abdominal wall down to the labia majora, which are part of the external genitalia. This is kind of interesting. Sometimes when women are pregnant and the uterus gets bigger, it pulls on these round ligaments, and the pregnant woman will feel pain in the external genitalia area, and that's because these ligaments are pulling. Right. So this one is the round ligament here, and that's the round ligament over here. And then cardinal ligaments are these ligaments back over here. You can see these ligaments, these kind of thin ligaments that are going to help keep the uterus from dropping down. Okay, so these are the ligaments that hold the uterus in place. Again, the broad ligament, big flat ligament. uterosacral ligaments, round ligaments, and the cardinal ligaments. So let's take a look at the regions of the uterus. Um, the top dome shape portion is known as the fundus. It kind of bubbles up from the body, and the body we're going to see is the central portion. It's the largest portion of the uterus. The kind of the constricted area of the body is known as the isthmus, and it kind of tells us the end of the body. And then within the body is the uterine cavity. So let's take a look at those structures. So this whole big area here is going to be the body. See where it constricts right about here? This is going to be the isthmus. This is going to be the end of the body. The part that bubbles up here is the fundus. And then on this picture, I like this. They cut into it so we can see the hollow part in here. This would be the cavity. Okay, so body, fundus. Let's make sure we got everything. Okay. The last part of the uterus is the lowest part. This actually projects down into the vaginal canal. Right? So this is going to be the inferior portion of the uterus. It extends from the isthmus down to the vagina, and it actually projects about a centimeter, 1.25 centimeter into the vaginal canal. So what we mean by that is this. So if you follow this tube going up, this is the vaginal canal. You can see the vaginal canal ends up over here and here. If you follow my cursor. So look at the cervix. It kind of projects down 1.25 centimeter like that. This opening, before I go back to the notes, let me just show you this opening here. This is where sperm would enter, is known as the external os. OS is an opening. Then there's a cervical canal. And then there's an internal os, or internal opening, and now the sperm can go into the uterine cavity. All right, so the parts of the cervix that I'd like you to know: the external os, cervical canal, internal os. Right, and then again you can see this cervix projecting down into the vaginal canal. Okay, so just make sure we cover the notes. So the cervix is the inferior portion of the uterus. It extends from the isthmus of the body down into the vagina, and it's going down about 1.25 centimeters. And then the parts that I want you to know are the external os, cervical canal, internal os. Nice and easy. So those are the regions of the uterus. Right? Let's take a look at the histology of the uterine wall. It turns out that the uterus has 3 layers. The way I set the notes up for you are from outside in. So we'll take a look at the perimetrium first. This is the outermost layer. This actually is going to become the broad ligament. Remember that big ligament, that flat ligament that extends laterally from the uterine wall is going to be the broad ligament. Now, there's 2 pouches that are kind of related to the perimetrium. Let's go this way for a second. I'm going to take you to this picture here. If you take a look, so this outermost layer is going to be the perimetrium right here. Notice how the perimetrium and the uterus project over the bladder, as I mentioned before. This pouch right here is known as the vesico. That pertains to the bladder. Uterine pouch. So right there. And then in the back, before I go back to the notes, we follow the perimetrium here between the uterus and the rectum back over here. This is the recto-uterine pouch. Okay. So let's go back to the notes for a second. So this vesico-uterine pouch, again, anteriorly the perimetrium covers the urinary bladder, forming that pouch. Again, vesico meaning the bladder, uterine obviously meaning the uterine. And then the recto-uterine pouch, same thing. Posteriorly, the perimetrium covers the rectum, forming a little bit of a deeper pouch. Right? Vesico-uterine, recto-uterine. Okay, so this is a picture of the wall of the uterine wall, kind of histologically. So this outer layer right here is what we're talking about right now. This is going to be the perimetrium. Right, you can ignore these blood vessels at the moment. I'll do those next. So now projecting in is going to be the myometrium. This is going to be the excuse me, this is going to be the middle layer, right? The middle layer. This is mostly smooth muscle. This is going to be layers of smooth muscle. And when you see it, it's pretty thick. There's a middle layer. There's I'm sorry, a circular and inner and outer layers. Um, they can be longitudinal or oblique. I'm not too worried about this, guys. You don't have to worry about this. Just know that we have these layers of smooth muscle. It's this smooth muscle that's going to be the muscle that causes like labor and delivery. So the myometrium is thickest in the fundus and thinnest down in the cervix. Nice, you can see. Watch this. Here is the perimetrium right out here. Look at this. These are the layers here, but all this is the myometrium, really thick layer. And this is going to be responsible for labor and delivery. The innermost layer is going to be called the endometrium, right? Endo meaning inner. So this is the innermost layer. It's highly vascularized. That's going to become important when I talk about the uterine cycle in another lecture. It contributes to about 10% of the mass of the uterus. It's very glandular. It's very vascular, but that's important because that supports pregnancy, right? We have conception and we have implantation. This endometrium becomes really, really important. So there's many uterine glands. We're going to see that they open up to the endometrial surface. And you'll see that they're actually quite large and they extend into the lamina propria. Again, anytime you see the term lamina propria, that's the areolar tissue underneath epithelium. Um, the estrogen hormones are important in that they have an effect on the uterine glands. So they cause the uterine glands, the blood vessels, and the epithelium to change monthly as part of the uterine cycle. So like I said, we'll talk about that in another lesson. All right, so this is again the important things you should walk away with today is that the endometrium is the innermost layer. It's highly vascular and glandular, and again, it becomes important for implantation. Okay, so let's take a look at this. So just to review, this was the perimetrium right out here, outer one. All this is going to be the myometrium. And then this here is going to be the endometrium. So all of this is the endometrium. Just to kind of give you an idea, here's some of the glands right over here. Here's a gland opening up to where the uterine cavity is. And you can see, again, all of this is very vascular. We're going to see a lot of blood vessels going into the endometrium. So the endometrium itself has two regions. There's an outer layer and a deeper layer. So let's talk about the more outer layer. This is known as the functional layer. They used to call it the stratum functionalis. This contains most of the uterine glands and it actually contributes to most of the thickness of the endometrium. This is the layer that's going to undergo a lot of changes and thickness and structure during the uterine cycle. We'll see in a minute. This is the part that actually sloughs off. Let's just say there is no pregnancy. This is the part that sloughs off during the menstrual cycle, and then it grows back again for the next month. So this one is actually, kind of changes from month to month and disappears and has to regrow. The layer that's just deep to the functional layer is the basal layer. All right, this is what they used to call the stratum basalis. So this is the deeper layer, and it's basically the connection of the endometrium to the myometrium. This is a permanent layer. All right, this does not change throughout the menstrual cycle or the uterine cycle. It pretty much stays the same. It's only the functional layer that's going to change. All right, so this is a permanent layer. It gives rise to a new stratum functionalis, right, that functional layer following each menstruation, right, if there was no pregnancy. So just to kind of give you an idea, this whole area from here to about where the muscle starts, maybe about there, this is going to be the endometrium, right? So this area closest to the muscle would be the stratum basalis or the basal layer. Then here's the functional layer. This is going to be the stratum functionalis. You can see it's got a lot of glands in it, that type of thing. And this is some of the tissue. And then here's going to be the kind of a simple columnar epithelium that's facing the uterine cavity. So during the menstrual cycle or the uterine cycle, this is the part from here to here that's going to slough off. All all this gets sloughed off and it has to be rebuilt. Okay, so let's take a look now at the blood supply of the uterus to finish up the uterus. One of the main arteries that is going to supply to the uterus, the main feed, is known as the internal iliac artery. That comes off of the common iliac artery. When we studied blood vessels, there was the common iliac artery, and that's split into an internal iliac and external iliac. Well, this is the internal iliac that goes inside the pelvis and ultimately is going to supply the uterus. So the branches that come off of the internal iliac artery are the first artery we're going to consider. These are known as the uterine arteries. They're basically bringing the blood from the internal iliac artery to the uterus. If we go to this picture for a moment, this would be the uterine artery, right? It's running and it's bringing the blood into the uterus, right? So you can see these branches here. These would all be the uterine artery. Now, from the uterine artery, we're going to see that the blood vessels are going to kind of arch around, hence the name arcuate arteries. So here you could see, here they have a whole one from the uterine arteries. Watch this. This is going to be the arcuate artery. See how they arch around in the myometrium? Right, here they are again. Here they are again. They just cut them. Right. So the arcuate arteries kind of arch around in the myometrium. Then the next artery we're going to see, these are the ones that are going to deliver the blood to the endometrium. So if you follow these arteries here, they're kind of radiating, right? They kind of look like the radiations. They're kind of radiating in to the endometrium. That's going to be our next artery on our list here. These are the radial arteries, right? So they're gonna really penetrate, through the myometrium and enter the endometrium. Now, as just before they kind of enter the endometrium, right? They're bringing the blood to the endometrium. You're going to see that they're going to split. The part that goes into the endometrium is going to be called the straight arterioles. Notice they're going only into the basal layer, the stratum basalis, and from there the spiral arteries are going to project further into the functional layer. So if you take a look here, you can see here's your radial artery. This part here that's staying in the, let's look up here. This is a good one here. This part here that's staying in the functional in the basal layer is the straight, right? This one's the straight, and then this one that projects into the functional layer, these are the spirals, right? So all of these here that go into the functional layer are going to be the spiral arteries. All right, so it runs uterine arteries, bring the blood into to the uterus, and then from there the uterine arteries are going to branch and kind of branch within the myometrium. Then the radial arteries are going to penetrate through the myometrium and head towards the endometrium. And then again, just before ending the endometrium, they're going to split. The straight arterioles are going to go into the basal layer of the endometrium, while the spiral arteries are going to go into the functional layer. Okay, and we'll talk about those blood vessels a little bit further when we look at the uterine cycle and we take a look at the menstrual flow and that type of thing. The last structure we want to go over in this lesson is the vagina. This is a fibromuscular tube, also located between the bladder and the rectum, so it just kind of extends down from the uterus. This is highly distensible, both for sexual intercourse and for labor and delivery. So it's going to allow for sexual intercourse. If there is no conception, right, there is no pregnancy, it's going to be an outlet for menstrual flow, right? So this is how the menstrual flow can leave the uterus, and if there is pregnancy, this is going to be the passageway for labor and delivery, for the baby to come down. Now, the fornix, this is a recess that surrounds the vaginal attachment to the cervix. I've used that term before because typically the sperm is going to be deposited into the posterior fornix. So what we have here This is going to be the entrance into the vaginal canal. You can see the vaginal canal is here. It has folds known as rugae. We'll talk about that in a minute. And then we saw from a moment ago, the cervix projects down about 1.25 centimeter into the vaginal canal. So this kind of recess right here and here is the fornix that I was just mentioning. Again, you can see here all the muscular muscle lining the wall of the vaginal canal. It's a kind of a fibromuscular tube. Now, under the microscope, if you looked at the vaginal canal, you would take a look and you would see non-keratinized stratified squamous epithelium, right? So that's going to be layers and layers of flat cells. However, they don't have keratin. And again, the transverse folds of the stratified squamous epithelium are known as the rugae. Again, so you can see all of these um, folds that line the uterus, right? So fornix, right there, cervix, all of these are the folds, and again, this would be the entrance into the vaginal canal right over here. And this is what it would look like under the microscope. So again, this would be the vaginal canal. This would be the actual stratified squamous epithelium, right? Layers and layers of flat cells, and then some connective tissue underneath it, and then we'll run all the way into the muscle over here. Right? So that concludes this lesson, right, where we looked at the uterus and the vagina.